am ASP Theresa Safubonsu, a midwife at the Reproductive Health Unit of the Ghana Police Hospital. Today, we are talking about cervical cancer. Cervical cancer is caused by persistent infection with high-risk human papilloma virus, commonly called HPV. HPV is a very common sexually transmitted infection. Typically, types 16 and 18 are more oncogenic. They cause about 70 to 75% of all cervical cancers. The mode of transmission of HPV is usually sexual, through the sexual means. However, there are other non-sexual forms of HPV transmission. With the sexual means of transmission, we have the manual genital, and the oral genital. With the non-sexual means of transmission, we have the vertical transmission, typically the mother-to-child transmission, and the horizontal, through infected doorknobs, ablution kettles, sharing sex toys. They are all forms of horizontal transmission of HPV. Now, risk factors for cervical cancer. The first, I would say, is multiple sexual partners, or a partner with multiple sexual partners. Early coitus, or what we call early age of initiating sex. We also have immunosuppression. A weakened immune system also predisposes you to cervical cancer. We have recurrent sexually transmitted infections that we don't treat, or douching, chemical douching is also a risk factor. Multiparity is also a risk factor. And prolonged use of oral contraceptive, combined oral contraceptive pills. I could go on and on. Even poverty could be a risk factor, where a woman who even received free screening can't afford treatment. Cervical cancer is a treatable disease condition. It can actually be prevented as well. It is treatable when found early. So yes, that moves me straight to some of the signs and symptoms. Typically, there are no signs and symptoms. You only see those symptoms when the disease has progressed. There is no sign and symptom for HPV infection and even the precancer. So once you see signs or symptoms, then it means it's probably advanced. And some of the symptoms include postcoital bleeding. It could be intermenstrual bleeding or postmenopausal bleeding. You could have abnormal vaginal discharge and back pain, leg pain, anemia, you lose weight, and others. So those are the signs that shows that probably the disease has progressed. Globally, in 2022, the WHO reported that there were over 600,000 new cases of cervical cancer reported, out of which more than half died from the disease. In Ghana, current estimates puts it around 3,000 plus new cases every year, out of which more than half also die. So with prevention of cervical cancer, I look at it in two ways. I would say there is primary prevention and secondary prevention. For primary prevention, it's usually about what to do so that you don't get the infection in the first place. And first on that list, I would say would be lifestyle modification, especially sexual lifestyle modification. I've already listed some of the risk factors, so you modify all those things that could put you at risk, especially the sexual lifestyle modification. There is also vaccination. In my earlier statement, I said it is preventable. So there are vaccines to prevent cervical cancer. The HPV vaccines are available. You pay something and you get injected, and it protects you from getting HPV that could cause cervical cancer. But the secondary prevention is basically screening. You have to screen for precancerous lesions, and then treatment is also there. If after screening we find something, we can also treat so that you don't progress to cancer. So with the secondary prevention, what to do so that even if we find something, you don't progress to cervical cancer. And it's basically screen. You do your routine screening. If usually after 30 years, but you can screen from 25 going. You can screen with screening. We have molecular testing, typically the HPV DNA test. We also have secondary prevention. That is what to do so that you don't progress to cancer. It is typically screening. You screen for any pre-malignant lesions, and treatment is also part. Prevention, we also have secondary prevention. It has to do with after HPV infection, what do you do so you don't progress to cancer? Screening is the first. We screen for pre-malignant lesions. With the screening, we have the molecular testing. An example is the HPV DNA test. We also have cytology, pap smear, liquid-based cytology, are part of the screening methods. We also have visual inspection methods, VIA, called visual inspection with acetic acid. We also have the visual inspection under magnification, colposcopy, also part. So that is for the screening. We also have treatment. You can treat. If we find that there is any malignant lesion, usually we treat, and treatment is in two forms. It's either ablative treatment or excisional treatment. With the ablative, it could be cryotherapy or thermal coagulation, and with the excisional, usually performed by the gynae oncologist, it could be a lip or leads or sweats. I don't want to bore you, so that's it for the treatment. Thank you. January is Cervical Cancer Awareness Month, and for us, we go beyond January. Cervical cancer is preventable and treatable when caught early. So at this point, I would like to encourage all women to get their regular cervical cancer screening. You should get vaccinated against HPV, and lifestyle modification. You quit smoking, you practice safe sex, and maintain a healthy lifestyle. Also, early detection is key. Don't delay seeking medical attention if you see any unusual symptoms. Currently, HPV vaccines are not part of the nationwide childhood vaccination program, immunization program. So I would encourage children, boys and girls 9 to 14 years can be vaccinated against HPV. So once you can afford, you can take your boy and your girl child aged 19 to 14 years to any facility that they can get the vaccines. And we are sure to help fight cervical cancer. Once again, I would like to thank everyone for watching. I am ASP Theresa Safugonsu. You can visit us at the Family Planning Unit of the Ghana Police Hospital to get your screening done. Thank you very much.